The experience of living with a mental disorder is unique to each individual. This usually involves a person's thought, perceptions, beliefs, emotions, behaviors, and relationships with others. When problems last for a long time, they strongly impact the person's life and decrease their ability to function. These can be called severe mental disorders. Typical examples of how severe mental disorders have been classified include psychotic disorders of all kinds, severe mood and anxiety disorders including serious forms of depression, bipolar disorder and PTSD, and severe clinical conditions related to alcohol or substance use. A number of other conditions considered to need a similar level of protection and support include severe developmental disorders such as autism, neurological disorders and neuropsychiatric conditions such as epilepsy, delirium and dementia, risk behaviors commonly associated with mental disorders such as suicidal feelings, self-harm, and locally defined severe mental health conditions. We will be talking more about language and cultural considerations later in this module. People on the move face several stresses that can cause high levels of distress. Some reports and research suggest a high prevalence of mental disorders in migrants and refugees. Some even assume that most migrants and refugees have mental disorders. However, this evidence base has methodological limits and tends to conflate all emotional distress with mental disorder. IOM MHPSS programs should not reinforce unhelpful and incorrect ideas like this. Words matter, and it's important for MHPSS program managers and teams not to use language that pathologizes and incorrectly labels a whole group. However, in situations of armed conflicts, natural disasters, mass displacement and migration crises, the relatively small number of people with severe mental disorders are among the most vulnerable. The causes of most severe mental disorders are not known. Discussion on the interplay between biological factors and factors within the social environment can be found in the manual chapter. Treatment and support of people with severe mental disorders typically includes a combination of biological, social, and psychological interventions. Even where pharmacological medication is prescribed, other forms of individual and social supports are necessary. Many people with mental disorders can be helped with psychological and social interventions alone, without medication. During emergencies, there is a well-documented risk of both under-treating and over-medicalizing severe mental disorders. Those living with severe mental disorders need to receive appropriate support and care. A community-based approach would avoid hospitalization in dedicated institutions, provide care that is integrated in general and primary health care, involve the family and other caregivers in the treatment, and focus on improving the social and occupational functioning of the person. Global guidelines for severe mental disorders tend to focus on facility-based care for individuals rather than community-based approaches. However, communities are crucial to the support and care of people with severe mental disorders. Two overarching principles are to be both person-focused and community-focused. These two concepts underpin community-based approaches to supporting people with severe mental disorders.